Why is the global supply chain so vulnerable? How can a modern supply chain strategy leverage shared service models to increase efficiency and productivity? And what is supply chain immunity? I'll explore these questions and so much more with Dr. Rob Handfield, author of Enabling a More Resilient and Shared Supply Chain Strategy for the Nation, Lessons Learned from COVID-19, a special report from the IBM Center for the Business of Government and the Shared Services Leadership Coalition. Your report, which I think is quite timely and very insightful, reveals significant gaps in the government's response capacity to crisis of this magnitude. Could you perhaps introduce us or outline for us some of the limitations of the response that was noted in a recent state procurement official reports?
Yeah, and we also interviewed, as I indicated, chief state procurement officers in almost every state in the country, 47 out of 50. I think we missed Alaska and maybe Wyoming. But one of the things we found is that people just simply weren't prepared for this level of emergency. They were almost frozen, and they really weren't prepared to. They didn't have a playbook. They didn't have a plan to deal with this kind of an issue, and that's really important. That you have a plan, you have a playbook that can dictate. What are the governance elements? Who does what? What is the what information is required, et cetera. And the second big problem was lack of information. We couldn't tell what was going on. We didn't know, how much PPE there was in the country. We didn't know where the problems were occurring. There was no centralized data source that was reliable and dependable and real time. And things would change in the course of 8 hours, as we all know. And so we really didn't have good data for making decisions. And the third piece is we didn't have the right, for lack of a better word, expertise in how to manage supply chains. And now more than ever, I think we need government that has knowledge of demand forecasting, acquisition and contracting, modern warehouse management, transportation management. This becomes really critical in a pandemic, and we just didn't have that.
Your report does a wonderful job of identifying, Rob, the current gaps in strengthening that supply chain you just described. I was hoping you could identify some of those gaps, and how important is it to focus on, strengthening decision-making, information sharing, and expertise?
Well, those three components are really, really important. And just by way of introduction, what I actually worked on something called the Joint Acquisition Task Force during COVID, and we interviewed a lot of the people in FEMA and the National Stockpile, and it was incredible to me that people were completely unaware that the majority of their stuff came from China. So this showed a critical gap there in terms of strengthening the supply chain. Is we need to have what I call better market intelligence. And what I mean by that is we need to understand at a minimum where our stuff comes from. And we need to understand also what's going on in those countries where we're buying that stuff and being able to monitor those supply markets to make sure that we're not shut out, things aren't changing over there and we're on top of it. That information also has to be shared. So the second piece of that is we also need to coordinate with our healthcare providers, and we need to understand what is the current state that they have in terms of inventory, in terms of material. What's the current state of their ICUs? We're starting to see ICUs starting to fill up again. And then the third piece is, we also have to understand medically and clinically what's happening around the world. And I call this a medical intelligence or a national healthcare monitoring system, where we can understand, hey, there's early signs of, a rise in respiratory illnesses being admitted to emergency rooms in China. I wonder what's going on over there. There's suddenly a bunch of schools shutting down over there. That's odd. We should look into that. So we need to have a better system of keeping track of what's happening in terms of medical signals from around the globe. And when we have those three parts of it working together, you create, a much more resilient, or what I like to call an immune supply chain.
Rob, would you share what a governance framework would look like for an improved government response when so many actors are required to get this happening? So what would that governance framework look like?
Well, it's interesting you asked that, because there was one written up before the pandemic, and it was called the FEMCE, PHEMCE, and it was written by a group of government officials as part of the Assistant Secretary of Pandemic Response, or the ASPR office. That 2018 document, and I can refer you to it if you like, takes you step by step what should be done. It talks about building, the appropriate stockpiles. It talks about, as you say, who to alert during this system. It talks about a governing council, who needs to be part of that council, what agencies need to be represented, what are the kind of roles and responsibilities between the different parties. So it really provides an excellent viewpoint of how to coordinate. Unfortunately, it was never executed, and that was the problem. It never got executed, and unfortunately, that really left us a bit stranded.
So, Rob, your report does a wonderful job of identifying some of the issues affecting the supply chain. And one of those areas is the process issue. I was hoping you could tell us more about some of the current state issues around the process for supply chain.
Well, I think, when you operate a supply chain, there's several processes that have to take place. First of all, you have to have the material available. Our stockpile was not only depleted, but a lot of the stuff that was in there was completely, it was expired. It was the masks, you pull on them and the elastic band would snap off. So you need to have some very good, inventory management systems in place to be able to track how much inventory you have, to make sure you're turning that inventory, and to make sure that you're, reordering it on a timely basis. The second piece is knowing where to allocate that inventory when there's an emergency, and where to send it and how much of it to send. And this becomes really important if you don't have enough of it. So we did a study, and we looked at a number of the states across the country, and we found there was really no particular pattern in how they allocated inventory of PPE to these different locations. So in other words, it was sort of being done on an ad hoc basis. And so we think it's important to have some kind of methodology to be able to improve that allocation system. And the third piece is you need to have, what we call a control tower. And a control tower is just that. It's a summary of critical elements that are occurring, and that'll keep people up to date. And it's just like having a speedometer in your car. You don't want to know how fast you were going last week or 10 minutes ago. You want to understand what's going on right now. So we need to be able to link our inventory to real-time monitoring, real-time consumption, understanding, what's happening in the supply base, what's happening to material that's in transit. And we need that kind of a dashboard that can help us understand everything that's going on, so that shared services group, that governing council is constantly aware of what's happening and can make split-second decisions, react to problems as they're occurring.
Would you highlight, Rob, some of the key supply chain technology issues that you identified?
Absolutely. And I think I can summarize it in one word: visibility, right? We didn't have any material visibility within the national stockpile. We didn't even know where the inventory was. I interviewed some people, and they shared with me how, when material was inbound, people were taking pictures of it with their cell phones and uploading it to a SharePoint, because they didn't have basic barcode technology to track where the stuff was. Right. So it's incredible to hear that. But my jaw just dropped when I heard that. But, again, we need to invest in technology for our national response system, for our national stockpile, for our ASPR. And that requires that we have some level of real-time monitoring of inventory. We invest in barcode technology. It's not expensive. We need to have the collection systems that would collect that inventory. And then we need to have a crosswalk to the hospitals. And I've worked with a couple of companies. I worked with SAS, and they worked with the German government. The German government could see exactly how many patients they had in every ICU in the country. They were able to collect that level and that granularity of data to better help their allocation, their inventory management. We don't have that today. We're running blind. Our hospital network has no idea of doesn't have the data to share with the government of, what's our inventory levels? Are we short, critically short on any materials? How many patients are we coming in? What's happening in our ECUs? What kinds of cases are we seeing in those ECUs? That's all data that we need to be able to monitor, if we're going to be effective in managing these future threats. And today, again, there's no visibility. And, it's problematic, but I think people say, well, we don't want the government, looking into our databases and monitoring us. It's not about monitoring. It's about, being able to respond to a threat. So I think those investment in those kinds of cloud-based systems, they're not expensive, but it's something that getting agreement, I think, is going to be the critical on how to deploy some of this technology.
But Rob, in the previous segment, you mentioned your new book, Flow, which is due out in June of 2022. I was wondering, you kind of at a high level discussed your concept of supply chain immunity, the T cells, and having that baked in and knowing how to pivot and adapt to any type of shock to the system. Could you elaborate, maybe give us a preview of Flow and how it really kind of triumphs your idea of supply chain immunity?
Sure, I'd be happy to. So it's a different book. It's not your standard off the shelf supply chain book. And what Tom Linton, my co-author, who was the former chief supply chain officer at Flex, and I began to observe is that supply chains sort of have rules and behavioral characteristics that really mimic some of the rules that we see in physics. And when we started looking at physics, we observed how there's natural flows that occurs in physics. There's flows of water, there's flows of electricity, there's flows of compression and power. When you start looking at these laws of flow, you notice that things always flow down to their lowest point of gravity, right? In the natural world. And I think what we're seeing today is a major shift in the flow of how supply chains operate. And in the past, we've flowed to China. A lot of our trade has gone to China and to Asia. And today we're starting to see that we're really rethinking. Organizations are redesigning their supply chains. People are rethinking, maybe the lowest cost is not equated with the lowest price in China. Maybe the lowest cost is, actually having it on hand and having a manufacturer who's, within the same continent and you can order from, and the transportation cost is lower. And we're seeing this everywhere right now with the proliferation of shortages. These shortages, by the way, are not going to end in 2022. They're going to go on well into 2023 and likely in some categories like semiconductors into 24. And so I think what this requires is that we start rethinking how our supply chains flow, and we start redesigning them in such a way that we're rebuilding a new capability. And this capability I call supply chain immunity. And the idea is that we need to be able to withstand these shocks, better predict them, be better prepared for them, and know what to do when they occur.
This has been a special edition of the Business of Government Hour on building a more resilient supply chain with Dr. Rob Handfield, author of Enabling a More Resilient and Shared Supply Chain Strategy for the Nation, Lessons Learned from COVID-19, a special report from the IBM Center for the Business of Government and the Shared Services Leadership Coalition. You can download this and all Senate reports at businessofgovernment.org. Be sure to join us next time for another informative, insightful, and in-depth conversation on improving government leadership and its effectiveness. Until then, subscribe, download, or listen to the entire interview at Podcast One, iTunes, or on your favorite podcast app. And as always, that businessofgovernment.org.